You may have heard about vaccine protection waning over time and becoming less effective versus Omicron compared to previous variants. 2 doses of the vaccine or prior infection really don't do very much to protect you against symptomatic infection with Omicron. But getting a booster returns those levels of protection to what they used to be. Boosters are one of our most effective tools for preventing illness, both for us as individuals and at the community level. A booster dose leads to much broader and more advanced levels of immune protection. It triggers an immune response that is much more effective than what you get from your initial doses. After a booster, vaccine efficacy against symptomatic infection is nearly 75% and is nearly 90% protective against hospitalization. You're eligible for a booster 5 months after receiving your second Pfizer or Moderna vaccine and 2 months after receiving the Johnson & Johnson vaccine. Receiving a booster increases your levels of protection even if you've already had COVID. The more times your immune system can be trained to respond to the virus, the stronger that protection will be. The level of protection you get from having COVID depends on whether your illness was mild or severe, as well as how long it's been since infection. Omicron has also increased the chances of becoming reinfected, and the booster really helps reduce that risk. If you've had COVID recently, make sure to wait until your isolation period is over and you no longer have any symptoms before getting your booster.